My name is Adina Barlow. I'm the owner of Lifelong Wellness Center, and in this video series, I'm talking about the main things that my clients come in with pain regarding. Now, this one is tingling and numbness in the hands, or weakness in the hands and pain in the wrist. There's a group of tendons or of ligaments and tendons through your shoulder girdle and nerves and blood vessels that come out of your spine in your neck, go down through your shoulder, some in the front, some in the back and underneath your shoulder blade, and then down into your hand. Now, when your shoulders are forward and rounded in and your posture is forward, which is very common for most people, especially people who are at the desk a lot, or a lot of kids where you're sort of slumped over being cool, or you have your backpack on and you have to like keep it forward, or moms holding their newborn babies, nursing. All of this brings the shoulder forward and up, and it like pinches all of this space, and so it disallows blood flow and nerve flow down into the hands, and it causes problems. So what you can do about it is open up this space. Anything that opens is really helpful, and doing this constantly. Of course, posture, having a strong back, having a strong core, which I talked about in a previous video on shoulder and neck pain, but opening up the chest and the diaphragm, all of that helps the hands. So one of the ways you can do that is to do a pectoral stretch. That's these muscles here. Lean against a wall and stretch forward. So if I'm here, it sort of looks like this. And then stretching straight. This gets a little bit different muscle group. So it's straight armed, leaning back like this. And then opening up the shoulders in a fashion where I'm rounding up my hands in this whole shoulder bone and then stretching out like this. And it's pretty simple to do even without a wall, but you can do it on the floor. I'll show you. You can lean back and stretch open. It feels so good. Another thing you can do is use a band to open up your arms. If you don't have a band, that's fine. You can use a belt or any straight thing. You can use a broomstick, but you're bringing your arms out like this and down and then back around. So you're getting movement behind your body, where most of the movement we do is in front of us. You know, if you're a chef, you're chopping, if you're gardening, you know, a lot of stuff is just really in front of us. So we need to work on the things in the back. Open it up in whatever way feels good to you. And that's it for these. Oh, last one actually. Underneath the shoulder blade, there's a muscle called your subscapularis, and when it gets really tight, it disallows movement. It can stop proper grip and movement through the hands. So with that one, you can stretch like this, kind of like a tricep stretch, but you're pushing your hand away from you. So this is a regular tricep stretch. If you push your hand away, it looks like this. And as far as you can go. So again, this is kind of a tricep stretch, and then you push your hand away like this and stretch your arm open. But otherwise, all of the other arm opening things will help as well.